Computed tomography, or CT. A CT, or a CAT scan, stands for Computed Tomography Scan, which combines a series of X-ray images taken from different angles and creates a sequence of images like slices of the bones and soft tissues inside your body. Even the small structures such as the tiny blood vessels, depending on what part of your body is being scanned, you may be asked to wear a gown and remove any metal items such as a belt, jewelry, glasses, which may interfere with the images. Once you're in the scanning room, the technologist will ask you to lie in a comfortable bed that moves up and down and back and forth. You may be asked to take a special dye called contrast media, which helps highlight specific parts of your body on the scan. Contrast media may be given to you as a drink or as an injection. You may experience a warm feeling or a metallic taste in your mouth. Once you're comfortable, the technologist leaves the scanning room to the control examination room from a console next door. The technologist will be able to see, hear, and speak to you at all times by intercom and through the viewing window. You may be asked to hold your breath at certain moments, and the table will gently move you into the scanner, and its detectors rotate around you as it completes each separate view. You may hear buzzing, clicking, and whirring noises. CT scans expose you to a small amount of radiation. The dose depends on what type of scan you receive and is always kept as low as possible while making sure that the image quality is good for an accurate diagnosis. All doses are considered low dose, and newer machines and techniques require even less radiation that was previously used. The risk of missing a serious disorder by not having a medically appropriate CT scan is considerably greater than the risk of the scan itself, but like any medical test, if it is not needed, it should not be performed. Contrast media is iodine-based and in just a few patients can cause an allergic reaction. Please tell your doctor or let him know if you're allergic to contrast media or to iodine. Patients who have diabetes or renal disease require special care because the kidneys are involved in filtering iodine from the bloodstream. The examination usually takes between 10 minutes to half an hour. If there are any specific instructions you need to follow before the kind of CT scan you are having, these will be sent to you prior to your appointment. You can resume your normal activities immediately after the procedure. If you are given contrast, you may receive special instructions. In some cases, you might be asked to wait for a short period or before the exam, leaving to ensure that you feel well after. After the scan, you will likely be told to drink lots of fluids to help your kidneys flush the contrast material from your body. A specialty radiologist physician, like a doctor, especially Dr. Viana, will analyze your images and send a report to your doctor usually within 24 hours. Newer CT machines use new technology. For example, Siemens machines use somaton force technology. With somaton force technology, you can boost diagnostic imaging to the next level, enhance workflow automation to potentially reduce unwarranted variations, and offer personalized scanning. This brings image quality to the next level with free breathing and powerful imaging. It can scan obese, elderly, unconscious, or uncooperative patients without sedation and minimize motion artifacts. This is particularly important in pediatric CT, where it also can help reduce the need for potentially harmful sedation. With somaton force, you can maintain image quality by either reducing radiation dose and maintaining contrast concentration, or reducing contrast concentration and maintaining dose, protecting the patient through the ALARA principle. These fast 3D camera machines accommodate the smallest to the tallest with personalized scanning. With outstanding speed, power reserves, and sensitivity, Somaton Force adapts to every need, and smart automation adjusts scan parameters to every individual. With dual source imaging, CT transforms care delivery, which means it will give one of the most prominent examples of change in the context of emergency and trauma imaging.